Right, good morning everyone. I think we are back again. So when you come to study, you don't have to play with studying at all. So yesterday I posted a video, my last video yesterday, before the end of the day. I said I posted a concerning the what is it called, ambidextrine and closestline, which is jam and the so applause jam. So I said I'll be posting a video concerning argumentine, which is amoxicillin and clavulanate or clavulanic acid, and how you put it. So let's quickly talk about that now. Let's see about why we discuss about that. So let's go. There are things that you have to know about this argumentine of the thing. We have to cross-check amoxicillin first that it is an antibacterial that actually helps to treat many bacterial infections such as Salmonella typhi, such as urinary tract infection. But people never know about it. You know, some people in some places or in some health center, when you go to that place and then you complain of urinary tract infection and you are coming home, they give you amoxicillin. Some people will get it twisted and be like, they said I have fever. They never said amoxicillin is only for fever, but antibiotics. You get that's their common statements. They will have fever. That is their common statement. You know that. So they never said amoxicillin is for fever or sediment. No. It's not only for that. That is their common statement. Besides, fever is not a disease but a symptom. So you have to get this into your skull. So let's bring that one down. If that is the case, then clavulanic acid is also an antibacterial that helps in the respiratory tract infection, that helps on the pubic inflammatory diseases, that helps on the nose sinuses, something like that. It can actually help like that there. So what I'm trying to say in essence is that if these things actually combine together, and then they intend to serve a huge purpose, remember what is going to bring up. Remember the outcome. Yes, just remember the outcome, how it's going to be. So that is what we are going to be tackling today. In our lectures, I'll have to define or discuss many drugs. We talk about the indication, which is the usage. We are going to be talking about the pharmacokinetics, and we talk about the mode of action, and then as well we talk about the side effects. When it comes to side effect to pregnancy, patient side effect to lactation, I get in the point. So we have to talk about this, and is it actually applicable to ulcer patient? Yesterday we talked about how we have ulcer to be to be caused by non-steroidal anti-inflammatory drugs and all that. That one is by the way. So we started from the indication of what argumentine. Argumentine is a medical combination of amoxicillin and clavulanic acid or clavulanic tablet. So we serve a purpose of treating microbial and broad spectrum antibiotics such as the urinary tract infection, the throat infection. It can actually help on the liver infection. It can help on the pelvic inflammatory diseases, and as well it can help on the nose sinuses. So this thing, there are very many this thing can actually help. But when it comes to injury, if someone must have UTI to the urinary tract infection and comes to me and says, "Can you get argumentine?" The person will be somehow worried that I said I have infection. What the concern argumentine concern infection? Because many people what they think argumentine worked for is this thing. What is it called? Injury, a minor injury or postmortem. I get to the point, which is a cesarean section. A surgical incision after birth. For instance, if you must undergo CS, surgical cesarean section. I get in, but they say take argumentine or a severe injury or there is a fracture, or dislocation of the bone. They will say take that. They are trying to say that if we cross-check that in this instance it is an antibacterial and a broad spectrum antibacterial. If you have any challenges with your skin, that antibacterial and that bacterial infection can actually penetrate, then that one will help you a lot. Then when you come to the fracture or dislocation, they are trying to protect osteoporosis osteomyelitis and others, even arthritis and osteoarthritis. That is why it is good for you to take that when your conviction is what fracture. So all this kind of thing is what you have to take a good close at. See, if you say that a medical practitioner and medical expert prescribe drugs, first and foremost, before you put that person wrong, sit down and calculate very well. Calculate 100% that okay, fine. This is how this thing is, and this is how this thing is. So work on about that bring the relationship between this and this together. Something more maybe fiction, you get. So that is the mode of indication of that one. Then the mode of action. Let's talk about the what is it called? The argumentine first. I'll talk about the argumentine. How many of you are aware that argumentine is a beta metase what? Exhibitors or inhibitors, something like that. This thing is another big thing for us to study. We are talking about the mode of action of argumentine now, and it is a combination of this beta metase inhibitor and penicillin. Then, if that is the case, it's going to be belonging to two classes or two generations of drugs. Let's also leave that one behind. If you have that penicillin that is involved, there is a strong microbial or macrobial antibiotics or broad spectrum that helps on the wound. You get due to bacteria, one or two bacteria that might come through that might intervene. So that one helps there. So if you take argumentine for an instance for injury or a major injury for that matter, a serious one, a severe one, or burn for instance, then the penicillin is what will take place at this moment. Then as a box platoon, someone that just finished operation, either appendicitis, hernia, call it, they say take this thing, penicillin will still be the one to work there. Because if you have a stitched injury for instance, and then you experience some bacterial effect on that stitches, they might likely prescribe or recommend this penicillin for you. And penicillin is present in this argumentine. So let's talk about the other one, beta lactamase inhibitor, that is present in those particular argumentine. I think that one will actually help you to exhibit other antibacterial activities or antibacterial agents that might happen to you as a fracture patient, or you dislocate the ankle, the arthritis, or the osteoarthritis, or the osteoporosis, or osteomyelitis. This thing, I think that one will help you, will actually stand there and be working for you. So these are the things you have to understand and need to understand. Is it possible for you to understand all this as a medical practitioner, a medical student, or health expert? So if you know that, okay, fine, what is it called? Argumentine, this is where it stands for and this is where it stands for. For an example, if someone has a respiratory problem, such as the COPD now, are you getting the point? Which is pulmonary, what is it called? Pulmonary obstructive pulmonary disease. Yeah, you get, if someone should have this kind of condition or this thing, pneumonia, for example, then if you should give the person this argumentine, you have not done too much. You get, don't think that you are actually recommending more than or exceeding your head, your brain rating. No. You said you actually trying things in. Let's talk about something very important. Let's discuss about something crucial right now. And for example, someone is facing difficulty breathing, for instance. Then you confirm that the airway is being, tampered with, either with dust or with smoke, call it, or he have a problem with the lungs. Then this argumentine is not too big for you to recommend for that kind of person, because especially when you actually know the kind of problem he is having, or you know that this thing is respiratory problem, or this thing is what is it called, coronary artery disease. I get in the point, or how you know that this problem is actually related to the heart or to to respiratory system, don't even hesitate to actually recommend the argumentine because it will work very well for him or her. And this arena or in this space, you can add argumentine or erythromycin together because we're actually talking about the lungs aspect, I mean the respiratory system as a whole. So you must actually include this. You must actually include this. This is another tough lecture concerning the argumentine that you have to understand. Some people will be like, why do you give me argumentine? I don't have injury. When I mean in my own location here, I've actually used argumentine to handle urinary tract infection. How that thing actually happened that day is I'm not the one that used it here over here. But in my vicinity here, you might try to use argumentine. You know how costly argumentine is. You can add argumentine in medication of your patient, but they won't be able to afford it. So it's like they bring this treatment up, and they said I should help in rendering this treatment following the prescription of the medical doctor. They bring the prescription with the medical doctor. So I have to read through, and this guy is what argumentine. So once I had to purchase the argumentine and everything, what is this guy facing? Urinary tract infection. So that is to tell you that okay, urinary tract infection is not a what is it called? It's not a disease that only cyproflux, metronidazole, claim call it dexamethasone that can even these broad-spectrum antibiotics such as argumentine, and because all these things can actually work for argumentine. Remember, if you should take for an example, someone have fever, as you all normally say, or someone have malaria fever, or someone have a problem with the salmonella typhi or salmonella typhus, for an example, and it comes to you and says like, what can I take? So you give the person amoxicillin. I'm actually taking a little reference from what we have taught concerning the argumentine. You will take argumentine and you stay at amoxicillin. This is typically wrong. See, the combination of these drugs will be detailed in our lecture very soon, in our next lecture, because some people mix anacin with what is it called? This particular drugs, aspirin. Some people will be like, they will take aspirin, they will take anacin. They will say take 2 tablets in aspirin, take 2 tablets in anacin. That is typically wrong, my dear. It's wrong, bro. You get, because if you cross-check anacin, the content, they just brand this thing up. The content is aspirin. If you cross-check this thing, aspirin, it's still the aspirin. So you are taking 2 aspirin automatically. So when we talk about, there are many drugs like that that are giving us the kind of headache. There's one analgesic drug they invent now known as pain bears. This pain bears is the combination of acetic salicylic acid, which is the one you know as no pain, and acetaminophen. Fine, let's come to this now. This is not in our lecture, but let's just brush through. If you must take this one, bro, know that you are not going to be taking no pain, or you take Novocaine, the one you guys call Novocaine, which is acetaminophen. You will leave these two because only these pain bears contain the 2. So you won't take this. Instead of to take acetaminophen, you can rather take diclofenac or ibuprofen. And instead of you to take no pain alongside again, you can as well take what is called prednisolone. Are you getting the point? I want to mess with like you can do it like that so that it will work effectively for the person. If not, if there is any, if you should take one more than the other, if that one have a greater side effect, it must surely affect. Some people don't know that SS analgesic drugs, the one that they call the body pan. I want to buy all this body pan, resort to ulcer. That is why we have the NSAID ulcer, non-steroidal anti-inflammatory drugs ulcer. So let's actually rest our class here. Our next lecture will be talking about how drugs are combined medically, and then what we have to know about the combination of drugs before recommending. That's our next lecture. So you guys should stay tuned for the next lecture. It's going to be amazing. Please like, comment, as well as share. Thank you very much.